So another area of research that I'm really interested in is public health ethics, and particularly where it intersects research ethics. So I'm often asked why it can be difficult to get research ethics approval for certain studies. And for me, it comes down to the difference between medical ethics, research ethics, and public health ethics. And again, what's really at stake there is what is your highest ethical obligation and what is your practical objective in the relationship that you have. So for a doctor-patient relationship in a medical ethics sort of consideration, we're looking at the practical goal is treating the patient, and the highest ethical obligation is doing what's in the patient's best interest. So these are going to overlap very easily. In research ethics, your highest ethical obligation is the welfare of your participants, but your practical objective is actually generating generalizable data so that you can treat patients in the future. So it's not about the best interest of that individual participant, which is why your ethical obligations might sometimes be in conflict with your practical objective, which is why the ethical standards are so strict. If you have an unconscious patient that comes in and requires emergency care, you wouldn't necessarily have to have their consent immediately, because you're acting in their own best interest in a doctor-patient relationship. Research is very different because of that practical objective of getting that generalizable data for the population. You're looking at much more stringent consent procedures there. When we get to public health ethics, your practical objective is to protect the population's health, and that's also your highest ethical obligation. So the consent procedures are going to be very different in that context as well. So vaccination is a great example where the doctor-patient relationship would support the use of the vaccine. It is in the patient's best interest to be protected from disease, but there's also that population health element there. So achieving herd immunity is in the population's best interest. And where we sometimes have a conflict when it comes to public health ethics versus medical ethics is in the case of things like quarantine. So the patient may not want to be quarantined, they may not consider it in their own best interests, and they may not consent to it. But in terms of our ethical obligation to the community, sometimes we have to enforce these public health measures. We really have a complicated relationship when we're looking at public health research, because then all of those different definitions of ethical obligation come into play in the same relationship, and that I find really interesting. So that's somewhere in research that I really want to expand.